An increased range of movement can occur at both joints and muscles. When joints and muscles are stiff, tight, and tense, movement is restricted and pain is increased. A massage aims to relieve muscle tightness. When muscles are relaxed and increased in flexibility, the range of movement around a joint is increased. Extension occurs when the surfaces get farther apart and the bones straighten. Flexion results in a decrease of the angle at the joint and brings the bones closer together. These movements occur in the sagittal plane around a frontal coronal axis. Frontal plane movements around a sagittal axis occur at multiaxial joints like the ball and socket joint of the shoulder or ellipsoid joints. Abduction is movement away from the midline of the body, while adduction is movement toward the midline of the body. Movement around an axis through a line on a structure. Movement on a transverse plane around a longitudinal axis. Rotation occurs at ball and socket joints. Examples include rotation of the atlantoaxial joint and internal rotation of the humerus at the shoulder and femur of the hip. Circumduction is a combination of abduction and adduction, flexion, extension, and rotation and occurs at multiaxial joints. It follows a pine cone-shaped path of movement. Movements of the forearm. Turning the forearm from the supine position, which is palm up, to prone, which is palm down. Elevation and depression, protraction and retraction include the movement of the clavicle and scapula at the shoulder girdle. Elevation is upward, depression is downward, protraction is forward, and retraction is backward. The elbow is a hinge joint involving the humerus, ulna, and radius bones. It allows for flexion and extension, with the biceps and triceps moving this joint. The knee is a hinge joint involving the femur and tibia bones. It allows for flexion and extension, with the quadriceps and hamstrings moving this joint. The hip is a ball and socket joint involving the femur and pelvis bones. It allows for flexion, extension, abduction, adduction, rotation, and circumduction. It is not as great a range of movement as the shoulder but is much more stable. The shoulder is a ball and socket joint involving the humerus and scapula bones. It allows for flexion, extension, abduction, adduction, rotation, and circumduction. It has a greater range of movement than the hip but is not quite as stable.